So pelvic floor integrity is something that we lose over time, both men and women, but especially as a result of vaginal childbirth for women. Vaginal childbirth can be a very traumatic event for the pelvic floor, the muscles of the pelvic floor, the connective tissues, and can leave patients with lifelong problems with sexual function and urinary incontinence. Perhaps in the past, you have done Kegels exercises to improve the strength of the pelvic floor. Perhaps you've taken medications for urinary incontinence. Typically, we'll see some benefit with this, but certainly not long-lasting resolution of those symptoms. What we have now is something called EMSELLA. This is an electromagnetic chair that patients sit on for pelvic floor rehabilitation. Patients are fully clothed, sit on a chair in the privacy of a room watching television or reading a newspaper, and have electromagnetic waves pulsed through the pelvic floor from the chair in a 10-centimeter circular conical pattern. This happens for 28 minutes. There is no pain involved, but it elicits pelvic floor contractions that are what we call supramaximal. As we have done biofeedback therapy in my office for decades, we are able to, in about a 45-minute session, maybe get 15 really good Kegels exercises with a patient as we assist them in strengthening the pelvic floor. The difference between biofeedback and EMSELLA is actually quite large, because in a 28-minute session, there will be over 11,000 supramaximal pelvic floor contractions as a result of the electromagnetic forces from the chair. Once again, this is painless, but these are supramaximal contractions. And what I mean by that is that as the electromagnetic waves are fired, before the muscle, after it contracts, but before it has the ability to relax, it is hit with multiple more pulses so that the contraction contracts and builds upon itself, so that the muscle contraction is much stronger than you could ever create on your own doing Kegels exercises. So not only are there 11,000 or more contractions in 28 minutes, they are supramaximal contractions. So this is an extreme pelvic floor therapy. We recommend twice weekly sessions for 28 minutes each for 3 weeks, 6 sessions in all, and then perhaps follow-up sessions as much as you would like to or need to after that. This is truly a tremendous new technology that will improve muscle tone in the vagina and surrounding tissues, surrounding the urethra, and surrounding the muscles at the opening of the vagina, at the labia and the perineal body. All of these muscles will be enhanced and strengthened, and it allows you to control the urine if you're going to cough or laugh or sneeze, but it also improves your sexual response and sexual function. Finally, EMSELLA is FDA cleared for treatment of urinary incontinence and pelvic floor rehabilitation in women. So I hope that we've answered some of your questions about EMSELLA. Please visit us on our website or give us a call. We would be honored if you would allow us to help you with these very sensitive matters, and we are certain that we can meet your needs with this. Thank you.